Hello, everyone, and welcome to this week's DPC Learnings. Today, I'm super excited to talk about how you get to start to add value to your DC practice with a health coaching program. As a coach myself and somebody who uses a coach, I can't wait to have this conversation and dive in. Today, we've got Cecilia Lapolli, the Chief Operating Officer over at Terra Health Coaching, and Dr. Jonathan Bushman from Reliant Direct Primary Care. Would love to learn a little bit just about your context, like where are you guys from and what's happening in your clinic. So Dr. Bushman, I'll pass it over to you first.
All right. Well, thanks first and foremost for having me and just highlighting this partnership that I've been able to create with Terra as my helpers on the side for health coaching. So I'm in Oklahoma, rural Oklahoma. We have 4 different locations in rural Oklahoma. We have 8 clinicians, and been in business for a little over 5 years now in DPC. Loving it, going strong, and just continuing to grow.
Love it. Like even in rural Oklahoma, we get to see health coaching kind of take a leap. So Cecilia, tell us a little bit about your inspiration for Terra Health and where you're at in the world.
Yeah, so I'm originally from California, but I currently live in Mallorca in Spain. I did my MBA out here because why not? And decided to stay afterwards. So I'm actually the only one located outside of the US, but our whole team is in the US. And my partner, John, is located in Bethlehem in Pennsylvania. And the motivation for Terra is to bridge the gap between, direct primary care and the patient. So we're kind of that bridge in between to help patients optimize their health and their autonomous motivation for change.
Awesome. Like clearly you started to identify the problem that you're able to like bridge, but tell me a little bit about like why a DPC practice would want to use something like Terra Health.
Yeah. So first of all, thanks for having us. We're so excited to be here. And also I just want to highlight how great it is that DPCs have extra time with their patients. And actually it's something that Dr. Bushman had mentioned on our last call is that, extra time with your patients doesn't always translate to additional specialties. And there's so many cultural factors involved when you're working with a patient, and every patient brings something new to the table and has different motivations for change. And not every doctor is for every patient because it's just impossible to work like that. We're humans. So we each have our needs and we are there to bridge that gap. So in so many ways, patients, when you go in to see your doctor, and you get a diagnosis of some kind, let's say someone of Hispanic background that just got diagnosed with diabetes, that could be so daunting. They have no idea where to start. They have no idea where to change. They also go back to their home, and maybe their home is where the unhealthy habits started. And they could be in an ecosystem that maybe their DPC doesn't understand culturally. So we understand that it's so daunting for a patient to actually make those changes, but there's also so many factors involved: the motivation, the environment, their understanding of the medication and how it affects their body and what they need to do. So everyone needs a little bit of assistance, and we come in with accountability and support with lifestyle medicine health coaching.
I love hearing that. And I'm curious, like Dr. Bushman, like what was the thing that made Terra Health like attractive to you? Like when did you first notice the problem that they could solve?
So actually, I met John a couple of years ago at the Hint Summit and was immediately intrigued about what they were doing. So, but I'll be honest, I was my first audience. I wanted it myself. I was like, I think I could use this. Not because I just got diagnosed with diabetes, I haven't, but I was just like, man, I love this idea. I love coaching for various different things, life coaching, various different types of business coaching. I'm like, this is perfect. And I'll be honest, we actually, and COVID threw us off through it, but we had somebody in-house who was doing some health coaching, but it was just like, that's hard to do. And it's hard to, put enough food on the table trying to do it when you're a small practice and trying to grow. And it just didn't economically make sense for us. And so when I saw that this was an opportunity to be able to refer out and have this virtual service for health coaching and have that same kind of attention, it's a pretty easy thing. And John said, hey, I want to hook you up with one of our coaches. Let's see how this goes for you. And sometimes the proof is in the pudding. You get involved and you see the difference it can make in your own life. It's a lot easier to sell it to my patients and to be able to say, hey, I did this. I loved it. I think it was super useful for me. And I don't have diabetes, and I don't have this, and I don't have that. I just have a very busy schedule and a lot to manage, and we all do. And that's the cool part about the Terra health coaches, they hit on every single thing, whether it's the relationships or, everybody thinks it's just nutrition or diet, but it's far more than that. And I got to experience myself. That's the easiest sell.
I love that you walk the talk so you can share the experience. And so for those people that are wondering, like, what the heck is a health coach? Maybe Cecilia, you could speak a little bit more about, like, how do you get to support these folks in every day?
Yeah, so that's a great question, because I think there's a lot of confusion around what a health coach does. And I think it's just now starting to get visibility and traction now with the board certification, but we're not Instagram coaches. We are nationally board certified health and wellness coaches rooted in lifestyle medicine for sustainable change. So we're really the accountability and the support for your patients. And we're also a very diverse team. That's something we really value, because we want this to be as inclusive as possible. We also want to have a lot of options to match with your patients. Let's say a mother with 3 kids might get a coach that understands motherhood, or a Hispanic person wanting to get information about diabetes prevention. We might have someone that speaks Spanish and is a diabetes educator. So we really value having a diverse team, but we're rooted in accountability and support, education. So we're really helping the patient realize their own autonomous motivation and putting them back in the driver's seat, because it can be so scary, like I was saying, to get diagnosed with something and not know how to change, not know what brought you there in the first place, because genetics absolutely play a role, but we all know that our lifestyle plays an even bigger role. And so this is where we get the opportunity to work with your patients week by week on putting them back in the driver's seat and really discovering for themselves what works for their bodies, implementing different modalities around health and nutrition, including more fiber, even just walking, starting to walk, parking a little bit farther away to get a couple of extra steps in, and just finding that time and that balance, and doing one small step at a time, so that over a 90-day period, they actually experience pretty amazing transformation. And we'll talk about a couple of patients that have had some really great experiences with us, one of them being Dr. Bushman's patient. Where really just implementing small habit changes can be the most powerful thing. And when you have someone rooting you on, but in a way that holds you accountable, providing resources and education, and having someone show up and expecting you to show up on a weekly basis can be so powerful. And what I see when I have breakthrough calls is that sometimes these patients feel intimidated going in to see their doctor, but then when they can speak with a health coach, they bring their guards down a little bit, because it's, kind of an anonymous person. They can be open and they can really share what's on their heart and what's going on in their lives, and be transparent and honest about the struggles that they're going through. And that is hugely valuable, and really makes a difference. So you have someone on your team keeping your goals in front of you.
I love that. Maybe Dr. Bushman, you could speak to a little bit about, like, how does it work, the collaboration with you and Terra Health, and some of the benefits that you're actually seeing for your practice and your patients along the way?
Yeah, that's actually a super easy question to ask, because just like ordering a prescription or a referral for an x-ray or anything else, just within the EMR, I type in Terra as a referral. Boom, pops up. I tell them, doesn't even necessarily need the diagnosis, but I'll put the diagnosis in, what maybe the focus of their issues may be, and put in, I want a, there's Beth Holmes, I have to say hi. Put in a 12-week referral, and honestly, most of the time, Cecilia takes it from there, and that patient's contacted within the day, and it's pretty amazing. And so to the patient, it's similar to, you've put a referral in or order in that someone else is calling saying your prescription's ready, or we need to schedule you for this imaging. Instead, in health coaching, it's Cecilia going, hey, we'd like to hook you up with a coach, and we want to talk to you about this process and what it is that we're committed to doing with you and that your doctor has ordered for you to do. And it's pretty simple.
I love that. For those of you that are watching, like, if you've got any questions for Dr. Bushman or for Cecilia along the way, don't forget to drop those into the chat, because they're here to help support you. And Cecilia, I know you're going to say something before I cut you off, so I'll let you roll with it.
I just wanted to jump in on that. That's perfect, because we want to make it as simple as possible. The whole point is to make communication really easy, and for it to be really no added effort on your end to refer a patient. It comes directly out of your EMR. I get a fax and then I contact the patient. It's as easy as that. And, you can be as elaborate as you want in the referral. You can give details about what type of coaching you're prescribing for your patient, or I can speak with the patient just to see what feels best for them. And I will go through the options, and I can do that in detail afterwards. But really, we just want it to be as streamlined as possible. And you're in the loop the whole time from start to finish. When you refer that patient, you're getting the update if they signed up, you're getting the update on who the coach is. You also get the coach information. And if there's medications involved, it'll be kind of a support network from the coach, you as the provider, and me as supporting the coach and the patient. And you're getting updates every step of the way. So that is kind of the idea of the health coach pharmacy, is that there's no difference between prescribing a medication. You're just prescribing a health coach instead. And so the idea is they're getting lifestyle support alongside whatever other modalities they're taking on. If they are taking medications, we have health coaches that, we pair them with medically relevant and culturally relevant matches so that they're getting all the support that they need. So really it's meant to be as easy as possible, and it's an extension of your care.
Awesome. I love this. I mean, one of the things that I teach through our DPC accelerator and when I'm working with practices, right, is like, how do we increase engagement and compliance? And this is such a beautiful tool to kind of bridge those gaps, as you were saying earlier. And at the benefit of like not having to have the full-time staff and being able to scale with the opportunity through a partnership like this. I'm curious, Dr. Bushman, just around like your experience again and examples of your patients, maybe like opening up more to the health coaches and even having time. Is there anything you could speak to around that?
Yeah, and I will, and I'd like to give you an example. This literally just happened yesterday, and this is more on the like, how do you promote someone to get into coaching? I think honestly, that's the first and hardest step, because once they're doing it, I think they recognize the benefit, and the stories are great. But getting them to like agree to, I'm going to do this, or why do you want me to do this, or what does this look like? I literally had a gentleman yesterday who was telling me about going to the college national wrestling finals and how excited he was. And it was just, we were just a little chit chat at the beginning of the visit. And we get to the point where I said, you know what, I really feel like what would be most beneficial to you is, yes, I could give you more medication. I really, really want to drill down into your lifestyle and see what we can do to improve without more medication. And he goes, well, I already know what to do. I'm just not doing it. And I said, I want to take you back to Kansas City at the national finals in wrestling. There was one single common element among every athlete on the mat. Can you tell me what that was? And he's like, he threw out a couple of easy things, not where I'm going. And I said, they all had a coach. In fact, they had multiple coaches. And these guys are at the top of their game. They're not trying to learn how to wrestle. They know how to wrestle. They are the absolute best in the country. And they surround themselves with people who are in their ear, observing what they're doing and helping make these small changes, or sometimes making them aware of something they didn't see coming. And so I was like, in that same sort of fashion, that's what I'm doing for your health, is I'm going to put somebody in your corner, in your ear, who wants only the best out of you, regardless of how much you know to begin with, or how much you think you could have done on your own. Like that's the role of the coach. Mm-hmm. And really, when a patient gets that mentality of like, oh, okay, I can see that, because most of us have had a coach at some point, in a physical, athletic fashion, and we can kind of relate to that. And so, patients, their experience is when they start seeing improvements, the empowerment that they get from that. I think those emotionally is what I hear when patients come back and talk to me about it, is they feel very empowered that they did this. And yes, they did it with help, but they didn't do it with more medication.
Mm-hmm. Right. A lot of them don't even believe that it's possible to change, right? And they got the right person to support them along the way, and they accomplish things that they didn't even know they were capable of. So that was a really great example. Thanks for sharing that.
Can you, Cecilia, will you just speak to a little bit, because I know there's like a lot of collaboration, and Dr. Bushman pushes a button and gets you an order. Like, tell me a little bit about how you're communicating back to the practice and getting them relevant information that helps him understand where they are in their motivational path.
Well, that's a great question. We want to keep everyone in the loop. So basically, once he sends off that referral, I contact the patient and CC the doctor so that they know that we started that communication process. The patient will then set up a call, and I'll just have a 30-minute breakthrough call with them where we'll talk about their biggest desires, their needs, their goals. And then from there, I will let the doctor know if they did end up signing up for a coaching package, and which coach they'll be working with. And from there on, I will be sending monthly updates. So the coach is responsible for charting within our Healthy platform, which is the secure platform we use to communicate with our patients and with the doctors. And basically what the doctors can expect is that they get a monthly update from the coach where they get a summary on the patient on how they did overall, the habits they worked on, the challenges they experienced, any changes in their metrics, or if they've gone up or down in weight, and then also a weekly update on their score of how they did, if they're regressive, progressive, thriving, or neutral on a weekly basis. So they'll get kind of an overall picture of how they did. So that will go directly to their EMR. And so they'll expect to get, for example, if it's a 3-month program, they'll get 3 of those and then a full update at the very end. So we're in communication pretty much every 30 days. And then if the patient drops off, if they stopped attending their sessions, or if there's something more concerning happening, they're also getting that communication so that they're in the loop of kind of where that patient is at. Mm-hmm. So the beauty of it is when the patient finishes the program, when you as a provider sees them again, you'll actually know what happened in those last 90 days. Since the last appointment that you had with them, you'll have a snapshot of if they did have any changes to their blood work, you'll know why. They added more fiber, they started walking, they incorporated a mindfulness routine. So you'll actually know why they changed. Mm-hmm. And it's amazing. It's the first time really that, I mean, I just love speaking with providers about it, because they're like, this is great information to have, because I actually know what happened when they went home.
I love that. It's beautiful that they have you have a framework to operate in, and they can actually get like the guidance or support or the knowledge of what's happening outside of the 4 clinic walls. And so I'm curious, like Dr. Bushman, one, just in your experience with that, but also like how these results have led you to possibly think about other folks that might qualify for health coaching. Like, how do you identify patients in your clinic that may be supported by this type of relationship?
My sarcastic remark to that is if they're living and breathing, then they probably could use some benefit from a coach. I think coaching's for everybody. So, but when I really identify them, it's the ones who are looking for, and I actually do, much like I use the example of the other patient from yesterday, is I kind of gauge what it is that they're looking for. And I say, you kind of have 2 paths to choose right now, because I have the ability to do what it is that you want. This is a collective decision. So you're at the point where, in this case, you're at the point where I'm considering a basal insulin. We're going to start you on insulin because we're already on 2 medications and you're not getting it controlled. Or we take the other route and we say, hey, let's buckle down. Let's work hard. Let's use what other resources we have to really improve your lifestyle. He goes, well, I think that's probably the right thing to do. And I said, well, I agree, but I need to know that you're going to go there with me. And so that's the identification, is where's their mindset? Do they believe this is what they need or what's going to help them? And so I really want them to be bought in emotionally before I even make the referral. So, to me, I could make a referral for tons of people, but at the same time, I want to make sure I'm not wasting Terra's time, and these people are ready. They're ready to go and they understand what it is. So. Identification, there's so many people. It's just knowing where they're at in their kind of in their health and what it is they're looking for.
Awesome. And Cecilia, do you feel like there's like a sweet spot of folks that you guys work with really well from a patient perspective?
Yeah, I mean, right now we're getting a lot of requests on weight loss, and I really feel like some people are just at their wits' end and they don't know what else to do, and they've tried everything. And usually the people that are just curious about how they can get assisted and how they can, or even what health coaching is, because a lot of people are they don't know what is involved and what the support looks like. So anyone that's curious and has an open mind and wants change for themselves, and they want to feel more confident, and more in control of their health. So really, I just love talking to the patients, because wherever they're at is a good starting point. I just hope to spark curiosity and ask some questions that enable them to go to that place, to actually imagine that change is possible for them. So the sweet spot is really someone that has an open mind and is ready to do the work, because it is a lot of change. Over the course of the 90 days, it's one step at a time, but they need to show up for the calls. They need to show up because they're only going to experience the benefits if they put in the work. So I would say the people with an open mind come with curiosity, with questions, and the ones that are willing to show up on a week-to-week basis.
Awesome. I know during our prep, we were like, the way you do anything is, like, how you do anything is how you do everything, right, in life. And so, like, if we are able to put our best foot forward, then obviously our results will come. I see some of you've got some questions in like the logisticals of how it costs or how much it costs and how it works. We're going to tap into that in a second, but I would love for these two to share the use case or the case study of your patient that you've been working together on real quick to kind of just like codify what you're doing is working out there in the world.
Dr. Bushman, do you want to start with how you met Corey first and maybe go into just like what your experience was with him?
Yeah, so I practice rural medicine, community. I know my patients. I know them in the community for various different reasons. And actually, Corey started out as a contractor on my house, okay? And started asking some questions about what it is that I do. He's like, that just makes so much sense to me. So he became a member. I got some baseline labs, and his A1C was above the diabetic threshold, which was a new thing for him. And I remember the look of devastation on his face when I went over those labs with him. And at the time, he was tapping about 280 pounds, and he was very open about his alcohol use. He was very open about just living a lifestyle of whatever comes and enjoying it. And but the look on his face that day when he says, what do I do? Like, where do I go from here? I don't know how. I don't know how to change. And strangely enough, he'd been listening to lots of different podcasts about optimization and different health benefits, and he'd listened to all this stuff, but he just did not know how to put it into action. And I said, I think the very best thing I could do for you is hook you up with a coach and someone that's going to be there by your side and walk you through how to make those changes. And I was like, you're going to need that, not only the accountability, but just there's going to be some things that come up you don't know what to do. And I was like, let me do this with you. Let me hook you up. And he came back that first month. I think he lost 25 pounds. I mean, like, amazing. And really, primarily, the cessation was the biggest thing that really helped him in that. But then he started getting into everything about, he was paying attention to everything. Started walking with the whole family, not just him. Started walking with his wife and walking with his kids. And man, just the whole transformation for them as a family was incredible to watch. And he became a firm believer, but he didn't just do the 90 days. I mean, yes, he did with the coaching, but he just continued to push and push and push and push. Actually opened up doing a newsletter for other people that struggle in the same situations, and started kind of creating this community around him of people that he wanted to see them excel as well. So his personal experience and testimony to not only the coaching, but then the ability to sustain the changes that he learned within those first few months. I mean, he's obviously a great example. And he's been so open with it. And I believe that sort of a mentality and idea of coming to the table and saying, here I am, I'm teachable, I'm coachable. I'm not going to pretend I have it all together, because I know I don't. And, work with me, please. And that attitude was everything.
Yeah, that was actually a perfect example to tie into what we were talking about before. He came with an open mind. He was ready to learn, and he was curious. And the experiences that he experienced after 90 days was really remarkable, because his whole family was involved afterwards. I think he's 80 pounds down now. His A1C is normal again, and his wife is down 60 pounds and his son is down 40 pounds. And they walk together as a family. It's completely transformed their lives. And he started with really basic things. Like I said before, including more fiber and going for walks. It's really starting with the basics and kind of going from there. And he was really open about, and he didn't even come to us for his alcohol use, but that was one of the things. It was the byproduct of it. He ended up dramatically reducing his alcohol intake. And it was, he, through his own momentum, he started gaining that confidence and that self-efficacy to continue. And that inspired his family too. So it was completely transformative. So he obviously was, he's an amazing example, but really to tie it back to, he came with an open mind and curiosity and was ready to learn.
Those are always the best students, the ones who know nothing and then learn everything, right, at the same time. And so before we jump into how this works, Corey's testimonial is in the chat for those of you who want to like see this transformation. And Dr. Bush and I just had a note just around speaking to like the social determinants of health before we go into how this works.
Sure. So one of the things that is somewhat of a humbling thing as a primary care doctor is to look at the chart or the graph of social determinants of health and understand that your impact in the total health of an individual is maybe 10 to 20%. Okay. We may have overguessed or overestimated what we think we're capable of doing and helping people. And we do carry such a significant role in their lives. But when you think about everything else that surrounds this patient that you don't get into in a typical visit, what their living conditions are like. You don't go into their living room. You don't know what they have in the kitchen. You don't know what cooking supplies they have. You don't know if they even know how to cook, things like that. And income status and job satisfaction. And I know I'm mentioning different things that may not even be within that, but there's all these other various pieces that through the coaching you can dig. The coaches will dig into this and like, what's a barrier for you? And that's one of the common questions and common discussions is, what are these barriers? Because they exist in everyone's life. I don't care what walk of life you come from. If you have all the resources in the world, you still have barriers, and those barriers reside within that social determinants, right? And so, I just think that's a really important thing to recognize. Number one, as a primary care doc, is that you are limited. I mean, just naturally limited in terms of your influence. And for someone to be on the team with you to support your patients, to try to address those changeable or modifiable other factors within the social determinants is it's huge. That's I think a really kind of part of the magic of the health coaches.
Yeah, and that's something I wanted to expand upon too, is that my first question when I speak with the DPC that's open to working with us is, what is your patient population? Who are you seeing? Because we need to know that. That's so important. That could be the matching with who they're seeing is so important, because it's not just one size fits all in terms of a health coaching program. It needs to be personalized. So that is a conversation that we talk about. What is the diversity? Who are you seeing? And those social determinants of health really comes into play. We need to be open to who the patient is as a whole. What is their home life? Are they living with 3 generations of family? Do they have grandma cooking every single day? How do they make those lifestyle changes when they don't have total control in the kitchen? They're going to have a coach that's going to be there to help them navigate those challenges so that change is possible. So that's why it's so important how we match who you're actually paired with makes a really big difference.
I love that. It's like it takes a village, and you have like so many resources at your fingertips by pairing up and partnering with programs like this. So tell us a little bit about how your programs work. Like, how do people get started when their patients are coming into these coaching programs?
Yeah, so we have a lot of different options to kind of match needs, and we're also willing to work with you. If you have an idea and you want to create something, we can do that too. But mostly we have our standard weekly package, which is 3 months of coaching, and they're getting that weekly touch point with their coach. And we're in all of our programs, we're working the lifestyle medicine pillars. So we're really rooted in that as the first point of change. And so that is our most popular one. We also have group coaching programs that specify in areas that maybe a physician came to us with an idea and we had a coach that had that specialty, so we ran with it. So we have, for example, heart health for African-American women. We have a diabetes program. We have men's fertility. We have an alcohol awareness program coming, also a mastering menopause group. So we have a whole bunch of them. Also, if you're a physician that wants to be involved with these group coaching programs, we can do that as well, where a coach will come in to coach majority of the sessions, but you come in once a month. So it's a way to expand yourself, but you're not having to show up every single week. And then also we have our GLP-1 combination therapy program for weight loss. That's a year-long program. It's a bit more intensive so that we really hone in on lifestyle. And if your patient is taking a GLP-1 medication, they're getting that assistance. And our whole idea behind that program is to make sure that we're leading with lifestyle. So we're avoiding dependency on the drug. So we have a number of different options. If someone does a 3-month program, for example, Corey, he was very autonomous after his experience with Terry. But there are some patients that need that ongoing support. So there's also the option where they can continue and just have 2 sessions a month or even just 1 session a month for follow-on support. Also, if you're a new clinic and you're just getting started out and you need to refer out to us, that's totally fine. What you can do is, we'll talk and see what works best for your clinic. But basically, you can refer us your patients and then we can bill the patient directly. Also, you can incorporate us into your monthly subscription. There's different options there. But our programs run anywhere between $99 a month to $250 a month. So it's within that range. We try to keep it as affordable as possible. But the whole point is that they're getting a lot of attention on a weekly basis. So that care is happening consistently. And, they get access to the Healthy platform. The patient has access to their call links there. They have a journal, they have a habit tracker, and they can have a secure chat function with their coach. So they can basically text their coach through the app. So they're getting a lot of different angles of support. Would you have any questions based on what I explained?
Ted, we answered your question around how does the cost for the coaching work in the direct primary care. And I love that you guys have, you can meet the practice wherever they're at, right? So if you're brand new and you can't incorporate that into your subscription, or you're looking to add value and you've been around for a while, this is a great resource. And so I know that medical insurance companies make it difficult to use mental health services. And I think that most patients would like this approach. I think you're right on. And Dr. Bushman could probably speak to that firsthand. How many sessions a month? So that 90 days, you're saying they meet once a week there for those sessions?
So it's 12 sessions. The first session is longer. It's 75 minutes to really build that relationship and that rapport with your coach and really dive into your lifestyle already and come up with a game plan. Then after that, they have a 30-minute touch point where they'll meet weekly, and we assign different programs in between the calls. So actually we have little video programming on specific topics that the coach can assign if they're talking about negative self-talk one week, or how, if they need more information about nutrition, we have weekly videos that will be sent out to them. So they're getting a lot of engagement in between. But the actual live sessions, it's 12 in the 90-day period.
Awesome. I love it. I know I started coaching for 90 days. I've been doing it 5 years later, total advocate of making sure that you get support along the way. Question for you, Dr. Bushman. Are you offering weight loss medication as part of your practice, and are you wrapping health coaching into that at all?
So yes and yes. We've done both. So, and I've done pre-GLP-1 health coaching. I've done post-GLP-1 health coaching, and I've done it when it's together. So again, the thing about when I'm doing GLP-1s, I lead the conversation with, this is not just a medication therapy that I'm trying to get you involved in. This is a lifestyle change. And while a medication may work for you and it may work really well for you, if those lifestyle changes aren't made in addition to what you're doing, your results likely won't last. And so if you want to take best advantage of this and make it worth your time, energies, and money, this is our recommendation. And so, ultimately it's their choice. But again, that's where I'm trying to vet, what's their interest, where's their mindset. And, not that you don't treat people who only want medications, but you really, really want to promote, hey, medications are not the only answer. While they can work and help, they're not the only answer. So I hope that answers your question, but I have honestly very little reservations with doing them together.
Awesome. And then I know you mentioned some of the resources, Cecilia, that you had just talked about, the self-talk and other things, but Michael was asking, do you provide specific meal plans for people as well?
We have 2 RDs on our team that can help with that. But, you know, as a coach, we're really helping the patient figure out what works well for their body while working with whatever diagnosis they have or whatever conditions they're experiencing. But if we did write a diet plan, that would go to the RD. And actually, one of the best parts about this is if the coach feels that it's out of their scope, we bring in the RD to a session. So it'll be the coach, the RD, and the patient talking about what the best meal plan or what foods they could start to incorporate.
Awesome.
So short answer, yes.
Yeah. Amazing. Well, I want to thank you both and ask if there's anything else that you wanted to add. But before I do, want to remind people that are watching that Hint Summit is coming to Denver in September. You can meet Dr. Bushman and Cecilia there to ask more questions. And of course, there is information on our partnership page and in the chat for you to be able to reach out to Terra Health. And then over to you two. Anything else that you want our viewers or audience to know before we sign off this afternoon?
Yeah, I'm just so grateful that we had this opportunity. So thank you so much for hosting us, and we're excited to meet you in Denver in September. And really, I think just our motivations are all the same. We want to create healthier communities, and this could be this could be the solution for so many people. So as long as we get the word out, we're happy to work with you. And please don't hesitate to contact me. I'd love to get on a call. We can work with your clinic. We can see what your needs are, what your patient needs are, and yeah. Thank you so much.
Awesome. Thank you.
Yeah, and I would just like to say, while I have the opportunity, thank you, Cecilia, and your whole team. Much like I look at my local colleagues and the specialists that I call on to help my patients when they're in need, I rely on you guys the same way. And so thank you for being there for us. It means a lot to us. And I didn't get paid to say that. I also don't get paid to say the next thing. The single most valuable conference I go to annually is the Hint Summit, if you want a chance to learn more about DPC or enhance your practice. So I love the work that you're both doing in your respective fashions. We all have a place in this ecosystem. And what I love about it is that we share the mentality of doing what's best for patients every day. And we've taken away all the misaligned incentives to do it. So just happy to be in the same ecosystem with you all.
And back at you. Thank you to everybody who showed up to learn more about how they can extend health into their communities. We appreciate you, and please be sure to reach out if you've got any questions to Terra Health, Dr. Bushman, or Hint, and let us know how we can better support you along the way. Thank you, guys.
Great. Thank you so much.
Yeah, thank you.
Everyone.